Which is the most relevant knowledge about oxygen administration to a client with COPD? The options are: Option A, oxygen at 1 to 2 liter per minute is given to maintain the hypoxic stimulus for breathing. Option B, hypoxia stimulates the central chemoreceptors in the medulla that make the client breath. Option C, oxygen is administered best using a non-breathing mask. Option D, blood gases are monitored using a pulse oximeter. The answer is option A. Oxygen at 1 to 2 liter per minute is given to maintain the hypoxic stimulus for breathing. COPD causes a chronic carbon dioxide retention that renders the medulla insensitive to carbon dioxide stimulation for breathing. The hypoxic state of client then becomes stimulus for breathing. Giving the client oxygen in low concentration will maintain the client's hypoxic drive. Doctor prescribes oral rifampicin and isoniazid for a client with a positive tuberculin skin test. When informing the client of this decision, the nurse knows that the purpose of this choice of treatment is to: Option A, cause less irritation to gastrointestinal tract. Option B, destroy resistant organism and promote proper blood level of the drug. Option C, gain a more rapid systemic effect. Option D, delay resistance and increase the tuberculostatic effect. The answer is option D, delay resistance and increase the tuberculostatic effect. Pulmonary tuberculosis is treated primarily with antitubercular agents for 6 to 12 months. A prolonged treatment duration is necessary to ensure eradication of organism and to prevent relapse. The increasing prevalence of drug resistance points to the need to being treatment with drugs in combination. Using drugs in combination can delay the drug resistance. A sense-taken Blackmore tube is inserted in the effort to stop the bleeding esophageal varices in client with complicated liver cirrhosis. Upon insertion of the tube, the client complains of difficulty of breathing. The first action of nurse is to: Option A, deflate the esophageal balloon. Option B, monitor vital signs. Option C, encourage him to take deep breath. Option D, notify the physician. The answer is option A, deflate the esophageal balloon. When a client with a sense-taken Blackmore tube develops difficulty of breathing, it means the tube is displaced and the inflated balloon is in oropharynx, causing airway obstruction. Days after abdominal surgery, the client's wound is the safest nursing intervention when this occurs is to: Option A, cover the wound with sterile moist saline dressing. Option B, approximate the wound edges with tapes. Option C, irrigate the wound with sterile saline. Option D, hold the abdominal content in place with a sterile gloved hand. The answer is option A, cover the wound with sterile moist saline dressing. The nurse is conducting an education section for a group of smokers in a stop smoking class, which finding would the nurse state as common symptom of lung cancer. Option A, dyspnea on exertion. Option B, foaming blood tinged sputum. Option C, wheezing sound on inspiration. Option D, chronic cough. The answer is option D, chronic cough. Cigarette smoke is a carcinogen that irritates and damages the respiratory epithelium. The irritation causes the cough, which initially may be dry, persistent, and unproductive. As the tumor enlarges, the obstruction of airway occurs and the cough may become productive due to infection. A client receiving heparin sodium asks the nurse how the drug works. Which of the following point would the nurse include in explanation to the client? Option A, it dissolve existing thrombi. Option B, it prevent the conversion of factors that are needed in the formation of clot. Option C, it inactivates thrombin that forms and dissolves existing thrombi. Option D, it interferes with vitamin K absorption. The answer is option B, it prevents the conversion of factors that are needed in the formation of clots. Heparin is an anticoagulant. It prevents the conversion of prothrombin to thrombin. It does not dissolve a clot. A patient with angina pectoris is being discharged home with nitroglycerin tablet. Which of the following instruction does the nurse include in teaching? Option A. When your chest pain begins, lie down and place one tablet under your tongue. If the pain continues, take another tablet in 5 minutes. Option B. Place one tablet under your tongue. If the pain is not relieved in 15 minutes, go to the hospital. Option C. Continue your activity and if the pain does not go away in 10 minutes, being taking the nitroglycerin tablet one every 5 minutes for 15 minutes, then go lie down. Option D. Place one nitroglycerin tablet under the tongue every 5 minutes for 3 doses. Go to the hospital if pain is unrelieved. The answer is option D. Place one nitroglycerin tablet under the tongue every 5 minutes for 3 doses. Go to the hospital if pain is unrelieved. Angina pectoris is caused by myocardial ischemia related to decreased coronary blood supply. Giving nitroglycerin will produce coronary vasodilation that improve the coronary blood flow in 3 to 5 minutes. If the chest pain is unrelieved after 3 tablets, there is a possibility of acute coronary occlusion that requires immediate medical attention. A client with a chronic heart failure has been placed on diet restricted to 2000 mg of sodium per day. The client demonstrates adequate knowledge if behaviors are evident such as not salting food and avoidance of which food. Option A, whole milk. Option B, canned sardines. Option C, plain nuts. Option D, eggs. The answer is option B, canned sardines. Canned foods are generally rich in sodium content as salt is used as in main preservative.